So I am so pleased. This is really one, I mean, there are many highlights to this conference, but this is definitely a big one, our patient panel, which we started maybe like, I think this might be our third year doing it. And it's amazing, you will see. And so this is really all discussion, and I would love to bring Mackenzie up, and she will introduce our moderator. Mackenzie is Vice President of our Junior Advisory Board, and she will introduce our moderator.
Thank you everyone for being here. I have the pleasure of introducing Dr. Kurt Weiss, and he is an associate professor in the University of Pittsburgh Department of Orthopedic Surgery, Division of Musculoskeletal Oncology. He has joint appointments in surgical oncology and pathology. He serves as an advisor dean for the University of Pittsburgh School of Medicine and as vice chair of transitional research for his department. The musculoskeletal oncology laboratory is focused on sarcoma metastatic potential. Much of this transitional work is accomplished with samples from musculoskeletal oncology tumor registry and the tissue bank. Dr. Weiss and his clinical partners established in 2012, the motor now holds over 18,000 unique samples from over 600 sarcoma patients with this clinical annotation, making it one of the largest sarcoma tissue reposits in the country. This resource provides vital biological reagents for both intramural and extramural sarcoma investors who collaborate with them all. Dr. Weiss is an author on over 800 peer-reviewed publications. He is on a scientific steering committee for the Sarcoma Alliance Research through collaboration. He is on the mentorship committee for the Connective Tissue Oncology Society, for which he has also served as board of directors. He has served as the chair of Musculoskeletal Tumor Society Research Committee. He was part of the inaugural Pragmatic Panel for the Department of Defense Rare Cancer Research Program. Dr. Weiss is a founding member of the Pittsburgh Cure Sarcoma Patient Advocacy Group, as well as the Pittsburgh Sarcoma Research Collaborative. He is a survivor of metastatic osteosarcoma and ascribes to be, his survival is participation in the phase 2 study of MTP-PE under the direction of Dr. Eugene Clearman. Here's Dr. Weiss. Yep.
Yeah, Mackenzie, that's my fault. That's ridiculously long. I really got to rewrite that. And it is, you guys, it is not 800 papers. Okay, it is 10% of that. So very quickly, just a couple of pertinent positives before I outline the way this is going to go. I feel like I'm in confession a little bit. This is my virgin experience in the patient panel. This is my third factor, but my first panel, so I'm like super excited, and I'm going to be taking my direction from these guys and from you much more than the other way around. So first things first, just a little bit more about me. I was diagnosed with metastatic osteosarcoma at the time of diagnosis, and had a progression of pulmonary mets while on treatment, so bad. And not having any other good options, I enrolled in a phase 2 clinical study for mifamortide MTP-PE, which we've already heard a lot about today. So if you were looking, you probably are not struggling in the Y department, but if you needed any additional Y for my colleagues in research who feel like they're pushing the same rock up the same hill every day, I'm alive because I participated in an experiment that that lady invented. So if you have any questions about why am I beating my head against the wall, because sarcoma research saves lives, and that's what you're doing every day. So thank you for being here, and you know, this is a tough climate. Stay in the game. Okay, so housekeeping issues, like Christina said, you can use the Slido. The only silly question is the one you don't ask. You can ask questions anonymously. We will prioritize questions from people in the room who get up to the mic, but even if your question doesn't get addressed, I'm told that it will be addressed in a post-hoc fashion. 100% of the questions on the Slido are going to be looked after. So don't worry that you're not going to be heard. You will be heard. The panelists will introduce themselves. You can come up to the podium, or you can do it from your seat as you wish. And then we will commence to the questions and answers. I met with the panelists prior to the panel, and am told that there are no sacred cows. There's nothing that's off limits, and you can ask these guys whatever you want, and that goes for me too. So with that being said, let's start out with Andrew.
Hi, my name is Andrew Bisaga. In 2017, I was diagnosed with osteosarcoma in my proximal femur after I was playing football and noticed a weird pain in my leg. I received the standard MAP chemotherapy treatment. I got limb salvage surgery. I was diagnosed, November of 2017, and I finished up chemo around July of 2018. And I've been NED coming up on 6 or 7 years now. Now I'm at Creighton University studying biology, and I hope to go to medical school after, so here's hoping. But.
Hi, I'm Elise Robinson. I was diagnosed when I was 8 years old. I am now 18. I'd say that was back in 2014 after I was on the trampoline for too long. I just had a weird pain in my leg, and then my parents finally brought me in. I had the standard MAP treatment and then a rotation plasty and then more of the MAP treatment. Since then, I have run cross country. I've played softball. I was a really good hitter. And I am now at Texas A&M for pre-nursing, and as of 2 weeks ago, I am now 10 years NED.
Hi, my name's Mackenzie. I'm 18. I was 14 when I was diagnosed in 2020. We found a big bump on my leg at the end of my sports season. I did cross country just to stay in shape. I'm not a distance runner. And soccer. So we found a bump. It took a while because it was COVID times, but eventually I got diagnosed. I had my first chemo during Christmas. I went home Christmas Day, had 9 months of MAP. I had limb salvage. I had a cadaver bone. I was cancer-free the next September. I had an infection in my leg after chemo, so I had to get it redone and had a new cadaver put in. At some point, I had cardiomyopathy, and it worsened with all the extra surgeries, so I ended up in heart failure. I had a heart pump for under 2 years, and about a week ago today is why I missed last factor. I had a heart transplant.
Hello, my name is Matthew Ceelen. I am 22 from Wisconsin. I was playing football with my local freshman high school football team, and I went for a tackle, broke a bone, and I was diagnosed with osteosarcoma in my left proximal humerus the following day. I was 14 at the time. 2 days after my 15th birthday, I started chemotherapy. I had MAP treatment. I had 2 limb salvage surgeries, and then also just a note, I thought I was unique. Here I am, you're my twin. I have also had mefirmatide, MTP, immunotherapy. So I was really, it was really nice to hear Dr. Palmarani speak about it. I am now 8 years NED. I just graduated from University of Wisconsin-Madison with a biomedical engineering degree, so I just have to say on Wisconsin. And I love to run. I pretty much feel very lucky about what I can do and here today.
Hi everyone, I'm Sona. I was diagnosed with osteosarcoma in 2019 at age 16, and at the time I was a soccer player, so my diagnosis came at the tail end of my soccer season, and I then was treated with standard MAP chemotherapy as well as MTP. And then I finished up treatment in November of 2020. I had a surgery to remove the tumor, which was in my left scapula, my dominant arm, and my scapula was then replaced with a cadaver bone. And now I just graduated from Tufts. I'm about 5 years NED, and I'll be starting medical school at Harvard in August. And I also love to run and have recently gotten very into rock climbing, which I know is surprising considering I have a shoulder limitation, but that's what I thought would be good to go for. And then I also just want to take a moment to honor osteo angel Michaela Bogan, who we sadly lost a few weeks ago to osteosarcoma. Michaela was my first upper extremity osteo friend, and I was honored to get to know her at Factor last year. She was a really cherished member of the Junior Advisory Board and an incredible friend to many of us. She was originally supposed to be on this panel, and I have no doubt she would have offered a really powerful and insightful perspective by sharing her story. So I'm sad she's not able to be here, but I know that she's deeply missed and will always be loved by all of us on the JAB.
So I do have a list of talking points that we can fall back on: fertility, quality of life, how the panelists wish, what had been done differently, should bad news be delivered differently, where do you stand on, communication just with you, with your parents, and it's written as revision surgery, but I would broaden that to complications, right? These are big surgeries. These are big treatments. Things go wrong. Things go badly wrong. So how do you persevere through that? But those are just some things that we can think about and fall back on. I guess I really want to let the audience and you guys kind of lead the way.
Hi, this is Elaine Green. I was diagnosed in 2020 with telangiectatic osteosarcoma and proximal tibia. And I've had a limb salvage with an allograft and now my first revision. First, I wanted to say thank you for letting me dance with you guys last night. I felt very included. My question is a very open-ended one. There are a number of other people that I have connected with through the osteosarcoma forums and Facebook and other social media, and I found that incredibly valuable. And I have a two-part question for you. One, do you guys use forums like that? And if so, what is your preferred forum? And second, we have been discussing starting a forum that is for long-term survivors so that it is really more about patients and engaging. And do you feel like your demographic is interested in that? And what could that look like? And what would make that more interesting to you?
I can go first. When you talk about forums, I'll take you back to 15-year-old Matthew. I would say, again, getting in my mind, I was 15 years old. I wanted to do high school football. Packers fan, I wanted to be Aaron Rodgers. So I thought I was going to be, really good. And then break my arm, got diagnosed with cancer, having, basically 2 days after having to be told that I'll have to do a huge limb salvage surgery, have to do MAP chemotherapy. It was very hard, obviously, to try to adjust to that. I would say, for me, I wanted to get away. I wanted to get away from just kind of the whole idea of being an osteosarcoma patient. So I didn't seek out any forums. I tried to live as much of a normal life as I could, try to really have this idea in my mind that this will just be a year thing and that's it. I'll move on with my life. After 8 years, I realized that no matter what, this is going to be a big part of your life. And so I would say MIB has really been a good networking system, a good system of support. And I would say every time I go to Factor, I feel like immediately I'm just like, these people know me. These people know what I've gone through. And so I would say in terms of forums, in terms of connectedness, this is my forum. This is it. So yeah, that's all I have to say.
I can go. I know you mentioned 2020. I was diagnosed in 2020, so it was COVID. I wasn't able to meet any other cancer patients on my floor. So that was like the first thought of because other people meet people while they're on the floor in the hospital. But immunosuppressed and then COVID happening, I wasn't able to meet anybody. So I didn't know anybody with cancer. I mean, I've heard of people, but I can't get out my room. I think MIB was the first type of forum where other people were like me. I don't think I had anything close to that before.
So in terms of day to day, I need a question to be answered. I need to reach out to phone a friend. Are you guys just, because I'm trying to get to what I think is the heart of the question. Is there a go-to place that is your preferred venue? If the answer is yeah, the people in this room, then that's cool. But I just want to make sure we clarify that for the question.
Yeah, I think a lot of the kind of questions I've had, especially now that I'm out of treatment, is more or less how far can I take my prosthetic and what can I do and what can I not do? And it always feels like I'm kind of not fighting, but it's like a push and pull with my orthopedic surgeon. I remember here in Salt Lake City, they've got an adaptive ski program. Skiing was something I used to do before I was diagnosed. And I I was like, oh, that seems pretty cool. I took it to him. I asked him what he thought about it, and he goes, I don't know. I did it, so I guess. But yeah, so thank you. Yeah. So I guess in the end, I do always kind of fall back on the physicians and the surgeons to get their opinion on what I can and can't do.
And speaking on behalf of the surgeons, we're really okay with you having some secrets from us. It's probably better that I don't know. All right, who's next?
Hey guys, being a non-biology person, I'm reminded how complicated the science gets. It's been kind of a long 2 days of science, and I think maybe you're not the right people to ask because we have a Harvard Medical School person and a biomedical engineer, but I saw some high school age kids on HQ yesterday at the prom event, and do you have any favorite resources to help connect them to the science when maybe they haven't had all of the science classes to really engage with this complicated but interesting research that's going on today?
I mean, I think one great resource is Osteobites, just to plug it. I mean, I think it's really niche to this community, and so even if you don't really understand the science, it's just cool to hear even little tidbits that you do understand and about your own disease as a patient. And I think that just hearing that and hearing all of these different approaches that are being taken to improve treatment and make it better is really cool. And gradually, the language becomes more familiar. And so I think, yeah, podcasts like Osteobites is a great resource because it's so like niche to our community.
Yeah, thanks for sharing everything with us. This is a Make It Better conference, and I wonder if you could just take the gloves off and tell all of us who are oncologists, surgeons, clinicians who are treating you, what could we have done or what can we do going forward to make it better? Obviously a cure, right? As the scientists are working on it, we want that, we are working on that. But when you think about your own experiences, what could we have done to make it better? What do we need to know when we have our next patient who comes in with osteosarcoma? Don't do that, or absolutely do this. Tell us, how can we make it better?
So I'm going to take moderator's privilege and insist that you all answer that question.
Thank you, Dr. Weiss.
One big thing, going back to that prosthetic again, so I got a limb salvage surgery. So when the time came to get that surgery, I had a choice of the prosthetic that I could get. So when I initially went to my surgeon, I was really sold on the idea of kind of cemented prosthetic that would have me walking pretty soon, but would require a few revisions, especially because that cement kind of, is harsh on the bone. And the one goal or the one want I had with a prosthetic was the least amount of revisions. I kind of wanted to get it and be done with it. But again, he was kind of pushing this cement prosthetic. I'm lucky to have a mom who's a nurse practitioner. She's kind of in the medical space, so she knew to kind of get second opinions. And I was fortunate enough to have grandparents who could stay with my two younger brothers. So we were able to kind of go, to a few different surgeons across the country. And I found the prosthetic I have now, compression prosthetic, which had a really long recovery time. I was on weight bearing for close to a year, but I really shouldn't have too many revisions, maybe a hip replacement surgery in the future. So all that to say, I think just giving your patients the most amount of options in terms of whether it's a prosthetic, but in terms of care in general. I think the more information you can give them to help them make an informed choice according to what their idea of quality of life is probably the most important thing.
Okay, Andrew kind of mostly said what I'm going to say is that, I was 8 at the time, so I could only understand so much of the information, but my parents were very, very big on they want all of the information they can get, and if there was no information or they weren't told something, they'd fill it in with their own like worse ideas. So really just like knowledge is power, like they wanted like all of the information. And luckily I feel like we were given a good amount of information. So I found the surgery that I wanted and my treatment went relatively well. I feel like I got lucky, but the big thing is they wanted all of the information they could get for it.
I would say something similar. I've had 6 leg surgeries, so definitely had lots of revisions, not really due to their part, but I think just more of not a positivity, toxicity mindset that this is it, that's gonna work the first time, and that's it. Because towards the end, with my first cadaver bone, we were looking at recovery time, and we kept looking at x-rays, and we just got pushed back on when I could start PT and start walking. And he kept saying I was like one of 2 patients that it took that long to heal the bone, incorporating into the cadaver. So it's like things like that. I would rather not sugarcoat things.
Yeah, just kind of reiterate pretty much everything. I think in terms of quality of life, expectations is a big factor. So I think something that my orthopedic oncologist did fairly well was give me all the options, make sure that I was informed, make sure that as much as a 15-year-old could understand what a fibular autograft and a humeral allograft is going to do, I had all the options available to me that they believed was going to provide the most success. I would say, again, in terms of optimism or realism, I believe that a patient physician interaction should be a partnership, should be a teamwork, and withholding information or being overly optimistic, I think is just going to harm the overall, I guess, experience in the long run. I remember when we talk about my physician, he was overly optimistic. He was like, "You're going to go play football again. You're going to do this." I love my life, but I promise you, I did not see the football field after that. So yeah, I would just say being real, having realistic expectations, because that's going to have the patient say, okay, I may not be able to get full mobility back, but I can work on physical therapy. I can do the best I can, and if I exceed expectations, that's wonderful, but if I meet expectations, then I meet them, so.
I think something that was really impactful and valuable for my family and huge for my quality of life was that my oncology team worked really well with my family and my parents to make sure that I was at home as much as possible and at home when I wanted to be. And I think that that's something that had such an impact on my quality of life and making it possible for me to be home for my birthday, making it possible so we could go on vacation for a week. They helped connect us with local clinics for some of the care that could be done closer to home so that we didn't always have to drive to the city, which could be upwards of 3 hours from Connecticut to New York City. And so that, I think, sometimes there were barriers to making that happen because oftentimes it wasn't the standard protocol. And I think that my oncology team really advocated and worked with my family to make it possible to collaborate with other sites and other people so that these things could be possible for me, and that was huge.
If I could just say another thing, I think outside of my orthopedic oncologist, my oncology care team did a really good job also in allowing me to try to live my life as best as I can, because we're in the hospital all the time. I remember I had methotrexate and I didn't clear, and so I went to homecoming with a bag of fluids. But I went to homecoming, so that's all that matters.
Okay. So Josh, you got your pen and pencil. So just to recap, I heard honesty, setting realistic expectations, finding out what quality of life looks like for that patient, setting expectations, give people options. It is a treatment team, which sometimes requires creativity. What did I miss? That's good? Okay, terrific. Next. Yeah.
I want to extend maybe a little bit the conversation from the last session into this session. And you're all now adults. You all have had a different experience than when you were originally diagnosed and decisions were being made. And most of you were in a situation where maybe you had some input, but others were making decisions for you. I wonder if you could go back and let's say when you were diagnosed, you were allowed to make decisions, and now knowing what the experience of treatment was, if someone had told you that you were someone who was in a good prognosis group that had a low risk of relapse and we think that therapy might be too much for you, we know that if you get this therapy, you've got like a 95% chance of survival. We think that we can preserve that by giving you less therapy. Is that an easy question for you to answer, given what you've been through? Or is that hard calculus? Would you rather have less therapy, or would you rather say, I'm going to stick with what we know?
I can answer this because I had chemo-induced cardiomyopathy, which eventually ended in heart failure, but as soon as they caught that, they went back on the doxorubicin. Yes. I know there was something going through the FDA at the time that was a preventative medicine, but I wasn't able to get that, but now they do have that, which I'm very glad about.
I guess I can go. I would say I would still do it in my sense, or in my case. I mean, I do have some hearing loss, and my kidney function is not as great as it could be. It's still really good, but you know, it was reduced from you know, methotrexate. But I do believe that I still would, just because I wanted to make sure that, you know, for me, it was a little bit better to be over, you know, do more than do less, because if you do less, it could be pretty catastrophic. But if you do more, you could still have a lot of setbacks, but you know that largely cancer was treated. I would say more so that the kind of going back on what I would do different, I think something about thinking about long-term, because we're all young adults or kids at the time, we're gonna have to live with the effects all our lives. And so having anything that would prevent any limitations, any side effects would be the thing that I would be most cautious of. So whether that be surgeries, whether that be any treatment we get.
So I'm going to press you guys a little bit on that, and I think this is something that probably maybe some parents in the audience want to speak with. Regarding Dr. Roberts' question, which is a great question, if there were a way we could identify you as somebody who was going to do great, and we think MAP, who is likely to do great, and we think that MAP might be a little bit of swatting a fly with a 2x4, should we write a trial that gives people the option to do that? And what would that look like? Or figure out if it's accurate or not? Yeah, I mean, talk about bravery, Brian. Yeah, what do you guys think?
I still would have gone through with the treatment I mean, it's not like that was an option for me, but looking back in the way that my parents and I talked about it when I was 8, I still would have very likely gone through with the treatment, even if it was like a 95%, like you probably will be okay. I probably still would have gone through with the chemotherapy at least, and then checked on the tumor.
Great. Hey guys, Joey from the University of Minnesota. I just wanted to thank you again for being vulnerable, putting yourself out there, and especially to all the osteo warriors here, because it really puts perspective as a researcher where the time and effort we do and things we do in the lab goes. So thank you so much for that again. My question's a little different. So I connect a lot with music, especially because I listen to it a lot while I'm writing or working. And I'm wondering if you could share with us 2 songs, one that defined kind of your treatment you know, time point while you're going through treatment, and then one during your recovery, and that'd be great. Thanks. Thank you.
All right, I'm a big Van Halen guy. So okay. So
Good
in
parenting.
treatment, we'll go with Jump. Might as well Jump. And then out, maybe Eruption. We'll go Eruption.
Okay, I don't know if any of y'all know The Last Dinner Party, but they have a song called By Your Side, and it's about like I'll hold your hand at 4 a.m., like I don't care what's going on, like I'll be there with you. And I feel like that was like a me and my mom during treatment kind of thing. And then afterwards, I'm gonna say like some Lady Gaga song, some like big like party, like we're here.
I don't know, during treatment, I feel like I listened to a lot of Taylor Swift and Noah Kahan. I don't know if I listened to the song during it, but he has one called Growing Sideways that I feel like kind of explains chemo a lot. After treatment, ooh, I don't know, that's a hard one. But I feel like I don't know, there's one Taylor Swift just came out with that was really fun. And she said she parties all the time. Like, she's depressed, but she still parties. So.
I would say going through treatment, I think Kendrick Lamar was a big one. And then when I was recovering, I really loved Bob Dylan, Blood on the Tracks. So two different spectrums.
Okay, I'm going to say, so during treatment, my dad is like the biggest Beatles fan ever, and we spent a lot of time in the car. So most of the time I subjected him to my music, but sometimes we would listen to some Beatles music, and there was this guitarist in my hospital who would come and play like whatever you wanted, and he did an awesome cover of Blackbird, so that was kind of like our song during treatment. And then after treatment, I was never really a pop girl prior to cancer, but I like had my pop moment and got really into Rihanna because I felt like I'm in my comeback era. So I would say that was my post-cancer.
Wait a second, come on now.
So, Winston Huff from Santa Fe. So, thank you for your perspectives. Keeping in the vein of making it better, so one area that continues to evolve is education about late effects. And can you give me your perspectives on how we can do it better as clinicians in giving you the education about potential late effects? Is it too much all at once, or these are the key things I want to know, or now as a young adult, I'm thinking about taking this job across the country or internationally. What are the key things I need to know so that way I stay informed? So, thanks.
So from what my mom has told me, I feel like there's no like one good way to do it. I feel like it varies by person, but definitely for my mom, she said that it was like drinking water out of like a fire hose. So I feel like she said there was no good way to give her as much information, but she wanted all the information. So I know we were given it all at once in different appointments, but she said it was all the information at once, and then she could go and look up stuff. But and then for me, I would always be in the room when the information was given, and I'd be in and I'd be on my iPad, I'd be listening, I'd be on my iPad. But then as soon as we were out of the room, my parents would ask me, well, did you understand that? And then I'd ask questions, they'd answer, I'd ask more. But I feel like there is no good way to give the information because it's not good information. But she wanted all of it.
I think for me, like Elise said, it's a lot of information all at once, and you're given chemotherapy. There's going to be a ton of possibilities for side effects. So I would say focusing. Again, having the ability for the patient to have all the information is crucial, but really emphasizing the most severe possibilities that you could have. I remember, for example, my physicians would talk about potential for heart failure, for cisplatin, and then like back to back, they would say, and you could have some potential hearing loss. And my heart is okay, but I apparently have mild to severe hearing loss in high frequencies. And I remember my audiologist would say, really serious face, you have mild to severe, or moderate to severe hearing loss in high frequencies. And I don't really care because it's going through chemotherapy, it's not really a big deal. But those major, something that could be as severe as a heart failure or whatever, I think that should be brought front and center in mind and not flooded by all the different possibilities that you could have.
I just wanted to add, I think one way that my ortho doctor did really well at explaining surgeries is he just drew it out. He'd draw that part of the leg and where the heart would go, and he explained it really well.
I'll agree with you there, Mackenzie. I think the best consult I did for one of my prosthetics, it's the one I actually have now, was when he took a piece of the paper that's on the bed, and he drew my leg and what the prosthetic was look like, what the prosthetic would look like, and I was like, oh, okay, I kind of get it now. So that's what I went with. So I think that helped.
Hi, my name is Leo Mascarenas. I'm from Cedars-Sinai in Los Angeles, California. And thank you for sharing your perspective. And I just wanted to say that, at least personally for me, my patients are an inspiration daily. So thank you. This is going to be a little controversial question, especially in this room, but I think we are in an atmosphere of trust over here because we want to make things better. And so I'm going to ask this question. And one of the reasons, we've learned a lot about osteosarcoma but haven't made an impact. But one of the things which a lot of researchers like and propose is to get on-treatment research biopsies. All right, and you could be coerced by your parents, you could be coerced by a physician, and now you're a young adult. What do you think of on-treatment research biopsies, which are not going to help you, but help the field? And if these biopsies are not being done during a time of diagnosis or on one of your surgeries?
So do you guys understand the question? So say after you've completed one cycle, okay, you're going to get a biopsy, just like you probably all had percutaneous biopsies. Dr. Leo's question was, to get that intermittently throughout the course of your treatment, not just at the beginning, so that the people in this room can figure out the biology better. Is that something that at all makes sense to you? Knowing that it's not going to help you, right? But it might help the next you. But it's an invasive thing. There's no getting around that. So have I understood your question, sir?
Yes. Yeah.
Okay. Let's say two. One, an additional one before surgery, an additional one after surgery.
Or if you had lung metastases, would you biopsy?
I did not have lung metastases, but I think treatment kind of just sucks in general, and sometimes things just suck. They don't suck more or less. So I think, 2 biopsies. It's gonna be bad. At least it's bad for good, right?
Honestly, at the time, I don't know if my parents would have been on board with that since there was already so much going on. But at 18, if looking back on that, I would have been on board. If it was my decision right now to do it, I would have done it. But I don't think that my parents would have done that to me at 8 years old.
Yeah, I agree with Elise. I don't know if we would have done it at the time, but looking back, we might have. I already do heart biopsies all the time, so I understand the routine of going under, but I didn't at the time, so it was just different.
Yeah, it's easy 8 years post-treatment being like, yeah, let's make it better. Let's do these biopsies. I wouldn't say I would say yeah. Or I'm sorry, that made no sense. I don't think I would say yes. I think 15 years old, so much is going on already, and especially having this super extensive limb salvage surgery, the idea of having additional, and you have port implant and then taking the port out. And then I had infection. I mean, I had so many things. I don't know if I would say, let's do a biopsy. Let's do that. Is it selfish? Well, but I mean, I could only take so much, I suppose, for surgeries.
Yeah, to be completely honest, I would say no today and back then, and I really want to support research. I know how important it is, but my biopsy was like the worst pain I experienced in my life, and I don't think that I could put myself through that again unless I was going to get reassurance that I would not experience that again. And yeah, so I think that I would probably have to say no as an adult and back then.
So probably, as you suspected, sir, you ask a really good question, and it's a mixed bag, even among these survivors with the benefit of hindsight. So I think there's appetite, but it's certainly not uniform, and for good reason.
Hi, I'm Dr. Rosie Kaplan. I work at the National Cancer Institute, and all of my patients with osteosarcoma now, I mean, I used to work at Sloan Kettering, but now they're all relapsed refractory and metastatic patients that come for clinical trials. And we have, so that's not relevant to all of you, thank goodness, I hope. But I think it is quite relevant because a lot of the patients I see say they wish they knew that the possibility was that they would recur or that they would not respond, and they wanted to talk to someone. We have material, something like Voicing My Choices is one of them, where we talk about like how you want to be treated. What would happen if this treatment doesn't work? How do you want to be told this? What do you think about talking to palliative care? The word palliative care scares people, like, but you're not palliative care in the way that we normally think of, like, oh, this means the end of your life. So I'm wondering, because I get the perspective from those patients that have had relapsed refractory disease. They tell me they wanted this sooner. But I haven't really asked an awesome group like you, which you are amazing and inspire me. But I would like to hear your perspective now that you've been through treatment and that you're well. Would you have wanted that kind of information, that kind of talk earlier on, being that, like, without being the, I won't say my nickname, but you know, you could think of nicknames that people could have when you talk about doom and gloom.
So just to clarify, just like communicating the possibility of a recurrence or metastases initially?
The possibility and offering either material or colleagues that would discuss that more in depth earlier on. Maybe, I'm not talking about like the first day, I'm not talking about that, but like earlier on in the process.
Yeah, that's a tough one for me to answer because I was 12 when I was diagnosed, and my understanding of it, which wasn't corrected until after I was done with treatment, I thought, you know, they were like, you're going to be on MAP chemotherapy, and I was like, oh, that's the solution, like it's going to work. And I didn't find out until like after diagnosis. I was talking with my mom, and she's like, no, it could have like not worked. So, yeah, I guess it's a tough, I mean, again, in hindsight, that might have been a little too much for a 12-year-old to handle, but at the same time, I think if you kind of like propose a therapy and it doesn't work, and then you go, oh yeah, I mean, we knew this might have been, there was a possibility of this, I think you do kind of fracture some trust between the patient and the physician. I think that's definitely a possibility, so.
Definitely yes. Again, all the information that we could have gotten, we used. So my parents, I'm pretty sure they were talked about the chance of reoccurrence and all of that. And I think that was very helpful in preparing for a possible future of that. Even though it didn't happen to me, I feel like they were very prepared into the future.
In terms of like other like medical professionals or care team, I've seen child life and palliative care not as an end of life thing, but just I'll come and check on you every once in a while thing. And I think that was really nice just because you're in the hospital so long, I always say it's a good buffer zone between the doctor and maybe you're too nervous to ask something and they can go ask for you.
In terms of information about palliative care and when the patient would want to get the information, I think being 15 years old and thinking, I mean, 15-year-old, I thought I was invincible. I thought I was, like, oh, I'm gonna get out of this. It's gonna be okay. I don't think it would ever have crossed my mind. I think having the physicians be realistic, and say this is a potential, and here are options. We can give you information about palliative care. In the case that it would come up, I think would be beneficial. I don't know if I think my parents would have probably seeked it out maybe, but I don't think I would personally seek it out because I was, I'm gonna get through this, so that was just my perspective.
I think that my understanding of palliative care is that it doesn't necessarily have to coincide with end-of-life care. And, right, it's kind of taboo, I think, because it is associated with end-of-life. And I think that, like, if we can get to a place where it's not so directly linked, that it would be more readily accepted by families. And I think that, like, I really accepted all types of supportive care that would improve my quality of life. And so when thinking about it, if like I fully understood that it wasn't necessarily like, oh, I'm getting this because we think, you're not going to make it, then yeah, that's gonna be hard for me to accept. But if I understand that it doesn't necessarily mean that, I think my family would be much more open-minded to it.
Yeah, hello, my name's Sean McMahon. I'm the father of another osteo warrior. And my question really kind of points to the third question on Slido, and that is, the more concerned with timing. When was the first time, I'd like to hear from each of you, when was the first time you communicated with another patient who'd been through what you were about to face? Was it pre-surgery, post-surgery? I know one of you was during COVID, so maybe it was online and during Zoom, but what was that interaction like, and what was the timing of it?
I think in terms of just talking with other osteo people, Matthew mentioned the hearing loss. We were talking the other day, going around the table, oh, I have hearing loss, I can't hear in this loud room. So I think it's just the common things that we get to bond over, or I had this, and I also had this. I know there's lots of different places where osteo can be, and I think even just finding somebody that had the same site initially, I think it's an automatic bond, honestly.
I remember I met one guy on my floor, but to me he was a big kid. He was like a teenager, and I'm pretty sure he didn't have osteosarcoma, but we bonded a little bit. It was more so my mom bonded with his mom, but I didn't have too many people to talk to about it until the Factor conferences. So I found my community after my cancer, but they're still here.
Yeah, I only had one other person that I knew in my hospital that had or was being treated for osteosarcoma, but I think it was definitely helpful. Maybe not even for, I know surgery's up there, but it was small things like when they would push saline, I remember I would like taste it and I don't want to be gross, but start to kind of vomit. So I remember talking to her and she's just like, if you just pound a Sprite during that saline, you don't taste it at all, chew gum or something. And that's a small thing. You get saline at countless times throughout your hospital stay, but not being able to taste it just improve that stay so much more. So I think, tips and tricks for treatment, I guess, from other peers is pretty crucial. I think it's, yeah.
Hi, my name is Alana. I work with SERB Pharmaceuticals. This is my third Factor. I have a business background. I do not have a science background. So I've been fortunate to get to know a lot of you on the junior advisory board and other osteo warriors and families. And one thing that I noticed through my conversations with a lot of you is that a lot of you were involved with athletics at the time of your diagnosis. And so I'm just curious if that has been studied or looked at, or it's just a coincidence, but that is my question.
I just want to say, you and my mom have a lot in common with that opinion. She strongly believes that there is potential evidence in having, an increased risk of osteosarcoma if you are an athlete. I was a nationally competitive gymnast before, and then I quit at the age of 14 to play football. So I was had a lot of stress on my joints, had a lot of stress on my whole body, honestly. So could that potentially have been a factor? I mean, I don't know, but yeah, I've heard that theory come up, and yeah, I could see it.
I'm gonna say I do not know, but that is a really good question, because I was noticing that as we were going down the table, and who I've talked to, we're all like athletes when we got diagnosed. So it's a good question. Me too. I'm wondering.
Over here, Fan Yang from Stanford University. I actually have a comment just to follow up with the question that was asked, because it also came up when I was talking to some of the osteo parents here. So I'm a PhD, actually a bioengineer by training. So I was actually telling the parents I was talking to that this is a question that biologists probably are not the best group to study, but it's a perfect question for engineers to study, because you need mechanical simulation, you need to have ways to build models to test. And it's something that I'm actually very interested in, potentially, writing a proposal and do some pilot study in my lab, just to follow up on that. So I'm a PhD, so I'm not a clinician, and I want to shift the gear outside of clinical part to think about how can PhD faculty do, or our labs or our resources can do to help make osteo survivors' life better. Because one thing I'm thinking is that many of the patients are actually high school kids or middle school kids thinking about getting to college, or maybe graduating after you have gone through all the treatment and adjusting, right? Like getting to thinking about the next phase of your life. So for example, I'm thinking like people like me, we have labs that have undergrads, graduate students, medical students, etc. If you could have a chance to visit a local university where a faculty could host you for a 2-hour visit, a half-day visit, or whatever, what would be the dream agenda that you want to have that catered to your needs? Just to throw out ideas, it could be talking to people in the lab. They can show you the kind of lab experiments they're running. It could be like you can talk to undergrads or graduate students or medical students in the lab that may have experiences that they could share with you about thinking about your future. So, or it could be just like a fun tour of the campus to see the gym, to see anything that they do for college life that is fun beyond study.
Well, I'm biased, I'm an engineer. I would say I'd be really interested in potential improvements for orthopedic implants. I think that, again, young adult, having limb salvage surgery early on in life, I am really, I'm very aware of the limitations that patients have throughout their whole life. And so having implants or, I guess, different surgical techniques to allow for a more full range of motion would be, and seeing research for that would be pretty uplifting. And then also immunotherapy. I'm really interested in immunotherapy, so seeing research on immunotherapy would be cool. And also, a little bit of background in stem cell and tissue engineering. I would like to see that as well. So.
I think I love the idea of doing normal things like a job fair that's centered to kids with cancer, because they don't want extra exposure with being immune compromised. Like here we have a big prom that's for cancer kids. So I love things like that, and I also love the idea, especially for those in medical field, to shadow.
Any other thoughts on that? Just real fast. So the question is, you're going to go to the lab of your friendly neighborhood osteosarcoma scientist, whether it's an engineer or someone else, and you get to set the agenda. What's the most important thing for that to include?
Yeah, I'll just keep it short. I'd echo what Matthew said, just improvements to prosthetics, range of motion, strength. I know a big issue with mine is that I can't really do like impact sports because that bone to prosthetic connection isn't as strong as bone to bone. So yeah, improvements to prosthetics is what I would probably set for an agenda.
Good afternoon. I just wanted to see if any of you can comment on lessons learned or your thought process or what you did to help your family and friends accept and get through your treatment. Do you have any recollections, lessons learned?
It was COVID, and my family mostly lives far away anyway, so we made sure to FaceTime family every night, either my brother and dad at home, because my brother was still in school, or my grandma, just staying connected. I mean, I'm not doing anything in the hospital, but I get to hear about their day, so.
I think, well, I was lucky I had my hospital I was treated at about 20 minutes away from my house, so it was pretty accessible to my parents. Actually, I would say my parents, I saw them every day. And then I think in terms of what was incredibly helpful for me was when I would go through those major surgeries and recovering, or I would just be, pretty much immobile. Having someone who was in the room with me was really efficacious in terms of comfort and feeling, I guess, happy, as happy as a person could be in that situation. Because for me, the feeling of being kind of left alone, and again, like after a surgery, you really can't move at all, it was pretty frightening. I remember, I had to spend Christmas after my second limb salvage surgery in the hospital, and there were some times where I'd just kind of be left alone. It could be even for a couple hours, but it just felt it didn't feel right, I should just say. So just having as much support as you can, both through social media or whatever, but also just in person was really helpful for me.
Okay, I'm gonna shout out to my sister, who's right here. But because I went through treatment during COVID, I was only allowed one family or guest in the hospital, and so she really never got to join. And I think that it's really important that siblings are included and that they feel like they're part of this journey equally. And yeah, I would say, I described her as brooding in one of my essays, so I'm not sure that she would have been the most entertaining guest, but I do think it's really important that siblings feel included and important, and that their voice and their story matters too.
I just want to add on to that, because my brother was, during COVID, and the policies, they all changed, but he was too young to even technically be there in the first place. So there was times he couldn't come in, but luckily they did sneak them in before surgery so I could see them just in case.
I'm agreeing with both of y'all 100%. Because I was 8, like kids were germy. I wasn't allowed to see any of my friends at all. But it was my younger sister. Even like my parents made sure she stayed away from me. But like we'd play Barbies like 10 feet apart, and that really got me through.
And not to beat a dead horse here, but yeah, I think especially being out of treatment and kind of like, you know, me and my 2 younger brothers are kind of more grown up, maybe you realize how much they kind of look up to you. So I think, you know, one thing I wish I would have done more during treatment is kind of including them, even just like, you know, talking to them in the hospital room more, or kind of going out from my room, you know, when I was home and just hanging out with them a little bit more. So.
Hi, so I just want to say thank you guys all for, you know, taking the time to share your experiences. I was 16 when I was diagnosed, and sorry, Mom, that you're going to have to hear this, but were any of you guys informed about fertility preservation? Because for me, it was kind of different. I had 2 oncologists. One of them told me about fertility preservation, but my primary oncologist, for personal reasons, I don't know if it was like too taboo or something, but, you know, that idea just didn't really come up much. So was it like, you know, consistent among you guys? I don't know if it's a male versus female thing, but I think that's kind of an important thing to touch on. I haven't heard anyone say anything about it. So, yeah.
I was informed about fertility, but it was also at the very beginning when my parents were told that their kid has cancer, and they were like, well, she needs to, like, we need to get this going. Like, I don't care too much about fertility, but they're very glad that they were informed about it because it's now affecting me. But they were told that because I was 8, I likely would be able to still have kids. And we checked it a week or 2 ago. I'm lucky. I could still have kids if I wanted to, but then it was also the process of like getting eggs and freezing them and preparing them took way too long, and we'd have to postpone treatment by way too long. So they threw it all aside. They're like, no, we're doing treatment.
Yeah, so I feel like I actually am the exception from a lot of stories that I've heard, but I had a really good experience right from the outset. Literally on my first day in the clinic, they set me up, you know, with all of the appointments, and one of them was with a fertility specialist, and they presented like 3 different options, and they were basically like, we kind of recommend that you do this, and if you want to do it, we can make it work. Like, we will work your treatment around, you know, the 2 weeks that you need to do the fertility preservation. And then they even went the step further to connect us with a local fertility clinic where I was able to get it in my town. And I think that it's a shame that not everybody is presented with those same options, because I'm really fortunate that I was fully educated, my family was fully educated about it, and we were able to do it on our terms.
Yeah, same thing with Sona. I think one of the things that my oncologist did really well is that when I was first diagnosed, and we kind of had to sit down basically saying, you are diagnosed, this is the treatment plan, and then almost in step, kind of the things that I had to do before I started my first chemotherapy. They're like, you're gonna get your sperm banked. And it wasn't, because I know for a lot of patients, talking to a lot of osteo warriors, that it was too many things going on before treatment. There wasn't enough time, but my physician said, this is the time. We scheduled it out. And you know, you can say, I'm good, I'm okay, or you know, you are proactive and you do a sperm bank, which is what I did. And I don't know if I'm fertile or not, but it's not that important to me because I know I have insurance. And so, yeah, like Sona said, I really strongly believe that it needs to be stressed.
So,
like
so
one of
they
the
drew
first
that
things.
plan out for you, though?
They brought it up.
Sorry?
So they drew that plan out for you, though? That was
They had a plan.
Wow.
And they already made an appointment. And, you know, I could show up, I could not show up. But, yeah, they already had an appointment. They're really, I think one of the things they did incredibly well was setting out a timeline of, this is all you have to do before treatment. And this is everything that you can do to give yourself some insurance, to give yourself some peace of mind, so that if you are infertile, we have insurance.
Yeah, it was brought up to me, and I feel like they gave me adequate information. I think logistically, it was brought up kind of in tandem with just with treatment as a whole. It was kind of like, this is the treatment you'll be getting, and by the way, this is also a risk. So I do kind of wish it was like a separate appointment, because like when you kind of just bring it up like that, I mean, I just want to get that conversation over as fast as possible. So I was just like, whatever. So I think a separate appointment where I can like mentally prepare and I know what I'm getting into, versus kind of, I mean, they didn't mean to put me on the spot, but I did feel kind of put on the spot there. So I think a separate appointment to kind of, get ready for it would have been better than what I got, so.
I'd like to ask a completely selfish question, and it's about survivorship. I'll try to be succinct, and I promise there's a question at the end. So, going through osteosarcoma treatment sucks, but it's straightforward, right? You wake up, you do whatever you got to do that day to see the next sunrise. You repeat as many times as necessary. But there comes a time when, if things go the way we want them to, when you're getting less and less scans, and there's no planned treatments, and there's no planned surgery, and well-meaning but clueless people say things like, well, you can put this behind you now, and it's time to move on with your life, and things like that. So, but how do you you might be done with osteosarcoma, but it ain't done with you. And how do you put the pieces of a life back together when the pieces are literally different sizes and shapes? And I see 100% of my patients struggle with that. And I can see that happening, but I'm besides saying, hey, I see you, Andrew, I see you going through this difficult thing, and it stinks, but you're going to be okay, and time's going to help. I don't have a good way to shepherd people through that. I don't even have the right vocabulary from a psychologic standpoint. So my questions are, number one, am I a crazy person? And number two, how can I make it better for you to shepherd you through that hard time of where you're figuring out how your life is going to look when your treatments are over?
I don't think that's a crazy question, because that's very understandable. It was really, really hard and really frustrating going back to school for 4th grade after being in like the cancer world, surrounded by like nurses and doctors. I was 8 years old talking to nurses. Like, I feel like I was like a mini adult. Like I was sitting there with realizing that life is fragile and all this stuff. And I go back to 4th grade and I'm around a bunch of kids. What is this? So I feel like, honestly, I didn't really feel like I was like completely back to normal. I mean, maybe it was just a coincidence, but once I went to the First Factor conference and I was surrounded by other people who've been through the same thing as me, and we all have been through the same thing, and we all have the different puzzle pieces trying to fit them all back together, that I was finally able to realize, like, this is normal. I am a normal kid. I'm around other kids who are at the same level as me. So I'd say really getting into a community that's at the same level as I was when I was out of treatment, because even now, I'm 10 years out, but the worst of it's in the past, but it's still a part of my life now. So every time I come to Factor, I get reminded of, like, I am normal. I'm around other people that are at the same level as me, and it's refreshing, because it reminds me that it is different than other people that I hang out with on a daily basis, but I'm not too different than them, because I'm not too different than these people.
Yeah, I feel like you can write a book on this called Half the Battle. I genuinely believe that, well, from my perspective, I had this whole idea of, I'm going to get treatment, I'm going to have a limb salvage surgery, and then I'm done. Like, I am normal life, living a normal life. But then I had an additional limb salvage surgery the following year, and on top of that, through treatment, I was a freshman in high school, and I'm from a suburb of Milwaukee, and I went to a high school in downtown Milwaukee. So everyone I knew there, that was the first time I met them, walking up the steps freshman year. So they all knew me as this guy with cancer, this student with cancer. And I think for me, it was really difficult in understanding who I am, who I have become. Because, like Elise said, you become so mature after, treatment. I mean, it's just, yeah. The level of insight I had about life, I kind of feel like I lost some stuff about that. But, after treatment. And then also the fact of relationships. So kind of going on that friendship, this is just going on in my mind the whole time, especially the fact that I didn't know anybody else really with osteosarcoma are they being nice to me just because they knew I had osteosarcoma, or are they being nice to me because they want to be my friend? Will I find a relationship? Because I don't know if anybody is going to, look at me and be like, yeah, it's okay, like, you had osteosarcoma, but, I still want to date you. I genuinely did not know if that was ever going to happen. And so I think that going along with the sense of community, being surrounded, or at least knowing and interacting with fellow osteosarcoma or osteo warriors was incredibly helpful, because I felt like I wasn't alone. I wasn't, completely unique in the worst sense of way. And, but yeah, just having that sense of identity was really important, and that's why I really love MIB. Along with the relationship thing as well, I just celebrated my 4-year anniversary with my girlfriend. So, yeah. Senior year, I found out, yes, I can still date.
I think thinking about the transition from chemo and treatment to survivorship, I felt a little bit abandoned, and like I went from seeing my oncology team every day to not seeing them much at all, kind of all of the sudden. And I don't think that that's the fault of anyone, and that's their job. And I know that all the healthcare providers are very busy people, and they have a lot of people to take care of. I think it's just the consequence of how it goes. But I did have a few, like one nurse practitioner who kept in touch with me, and to this day keeps in touch with me, and like that meant the world to me. And so I think little things like that can really help people, survivors who are transitioning, still feel like they're not completely forgotten.
I want to add on to that, because I have a nurse practitioner that's like that and actually came to my graduation. That was 3 hours away from her. So I think people like that still check in even though they're not on your team anymore. I got off of her team after I got rid of my LVAD and had my transplant, but she still keeps in touch. We still send her pictures. She sends us pictures of whenever she goes on vacations and stuff. But also, during my treatment, started COVID, I was a little thankful it started in COVID, because I was able to do school online. But because I kept having surgeries on my leg, I stayed online all through high school. So it was a little different. It was hard to make new friends, and also going to graduation, and you're looking around, but all you know is your teachers you see online, and you're looking around and you don't know anybody. But then you're texting the group chat, hey, I just graduated, So like people here, they understand what type of an accomplishment that is.
Yeah, I think just, again, speaking about the transition from kind of treatment to post-treatment, organizations like MIB have helped immensely. I think when I'm, at home and I'm like playing basketball with my friends, it's easy to feel like there's a part of you that's missing, or you're kind of like broken. Just, the way you walk, you can't do as many things as your friends. And they're great, but you do always kind of feel that lingering feeling like something's not there. So I think being here, I think there's just, it's easier to feel whole.
With that, I want to thank all the, have we got one more, Sam? Have we got time for one more?
Sure. I want to follow up on that. So I'm Sam, I'm a pediatric oncologist, and one of the things we're trying to do at Data for the Common Good is develop resources for young adult survivors. And so the question I have for you is, as now you move into this phase of your life when part of you is identifying with cancer, but a lot of you is moving on, what do you think about your continued connection to the medical system? And would you be willing to answer a text once in a while about how you're doing? Or what would you think about, how do you have access to your medical records as you go on? What would you think about getting information from email about, hey, you need this follow-up or that follow-up? How do you think about that as part of your everyday lives as something you may not want to think about all the time? And I'd be interested in anybody's feedback on that as we develop these resources for you guys.
Not to put you on the spot, but I think the Harvard med student Sona should answer this one.
Okay, well, I have to say I'm not a Harvard med student yet, so don't jinx me. But soon to be. I think that it depends on, like, is this for research purposes and to follow up on patients and see how they're doing, or more just...
I think it's both. I think it's one, to find out how people do as they go through their young adult phase, and I think it's also to provide you with resources, because what 12-year-old that had radiation is now thinking when they're 28 that they need to have this test or that test. So I think it's both for care and for research.
Yeah, I think I would be very open to doing something. I mean, I think it all depends on, like, the burden and the time commitment, but I think that, yeah, it's beneficial to both parties, researchers, and then also the patients themselves. And I remember I was at St. Jude in Dr. Gunther's lab for a summer, and I learned about St. Jude Life, and I think that program is really, really cool. And I think, yeah, it's a good example of kind of patients learning about their survivorship care and also providing data for survivorship research.
I agree with both them. I would definitely be open to that, or I don't know, imagine like a Google form or something. I just like write some stuff down, and then my providers are able to see how I'm doing throughout life. They get to like keep up with what I'm doing, and what I'm doing. But I go in for scans once a year. So for me, I feel like that's good enough for letting them know what's going on with my life.
I think it's a lot easier for me to give advice, give information about my experience, as opposed to wanting to go back in for scans. Like Elise said, I think once a year is good enough. I mean, I'm 8 years out. I feel like I'm out of the woods. So I think in terms of my health, I'm okay with just once a year scans, doing the CT, doing the MRI. But I love to give my perspective on my journey, and if I have any tips or anything like that.
All right, well, I want to really, I think we should all thank our panelists. Really.